Afternoon, welcome. It is February the 17th, 2022. I'm Matthew Holt, founder and publisher of the Healthcare blog, and it's THCB gang again. Okay, fab lineup of favorites today. We have on the male side of the equation, the M's, Ian Morrison, health futurist, and Michael Millenson from Health Quality Advisors. And on the female side of the ledger, Casey Quinlan, Healthcare is Hilarious podcast, and Jen Benz from Siegel Benz. All right, so we are off and running, and the big question of the day is, how many medals in the Winter Olympics did any of us win? No, none of us. Not watching that. My claim to fame is that I know the mother of the biggest star of the games, Eileen Gu, who's the one who decided to represent China rather than America. And I used to know her mother back in the 90s pretty well, and her daughter is seems to be doing all right. Apparently, if you go to China, she's the most celebrated person there and has like 25 endorsements, which proves today that Americans believe capitalism is more important than the country. Don't tell her mother I said that. I don't think she watches this show. All right. What have we all been up to this week? Can I start with you, Casey? Okay, I'll start with somebody who's not on mute. Ian.
I'm an idiot. No. I'm an idiot. That's fine.
That's right. Okay, I'm mute. So then go, Casey.
Already. I don't know. It's like, you're muted. It's like the commercial. Yeah. Anyway, I'm doing well. I'm still alive. So #winning. That's it.
Short but sweet.
Literally yesterday was Oncology Day. This is like, there's a lot of things on my radar, but let's see where you guide the discussion. I'm just
nothing to do with me. All right.
I'm going to stay stum.
Okay, excellent. That's the quietest I think, the shortest you've ever spoken. Ever. All right, Ian.
Well, I'm just happy to be on. This is my weekly or bi-weekly therapy session, so thank you. I actually went to a real meeting last week with 150 CEOs in person. So I got lots of stories from the road about that. I'm happy. I'm always happy with Casey and Michael being on, but I'm really happy Jen's on because I've got a little piece coming up with Elizabeth Mitchell about what employers are going to do. So I'd love to hear reactions around that. I spent some time with Elizabeth last week too, plotting and planning. So I think I think if there's a theme I heard, it was on the one hand, health systems have been hammered by COVID and they're beleaguered and under trouble, and the other employers have had it up to here. And I think we're in for an interesting year in that regard too. So, and let's hope the pandemic really is over and we're not about to pull a Denmark.
I have seen the Denmark chart and it's not encouraging, even though they're at 80% vaccinated or something.
Right.
Meanwhile, we're infecting our northern neighbors who are also 80% vaccinated with all kinds of random stuff from south of the border. So you can talk. We'll get your Canadian aspect of that soon, Ian. Given I know you're a former citizen. Former resident, anyway.
The Scottish Canadian California. My wife's a Canadian though, but actually, and on the Olympic connection, her old boyfriend's grandson is on the half pipe team, and he qualified for the final. He's 8th.
Oh, that's
for Canada. So Simon D'Artois.
Fantastic, Michael. I know you're a very keen half pipe snowboarder. Maybe not.
So we can talk about the difference between employers saying we're fed up circa 2022, 2000, 1990, 1987, et cetera, and how much credibility the employer community has as we go along. Obviously, we have now set a benchmark here in America that once a million people die, we don't want to talk about it anymore. So that must be that COVID is over. We've reached our tolerance for having it in the news. Let's move on. What's interesting is while we continue to have this tremendous public health, if not emergency, incredible impact, right? Long COVID and mental health things and the healthcare workforce burning out. You have on the other side, in the digital health world, consolidation and SPACs and all the rest of this. And it'll be interesting, on the one hand, you can see that as preparing for the day after, preparing for the years after, which I think is legitimate. At the same time, it's a little bit bizarre to watch upstairs, downstairs, as it were, of healthcare. So not necessarily a bad thing, but a sign of our times that I think is worth thinking about.
Yeah, absolutely. Jen,
Well, for those of you who know me, I am not a sports fan at all. I only know enough about it to be semi-fluent in daily conversation. But I was actually really excited about the Super Bowl this year and the health ads that were going on. The John Legend Headspace ad is pretty hilarious and kind of ridiculous. If you guys saw that, John Legend basically saying you can sleep with me with the Headspace ad. And then the Q medical device for the home testing device, that was one of the highest rated ads at the Super Bowl and got just a ton of traction. So I think that's super interesting in terms of consumer medical devices and the focus on that in the home. So that was that's kind of my interesting thing of the week that I've been looking at.
Yeah, I think that was pretty fascinating. I didn't think the John Legend ad was funny as all that, although, you know, the fact that there's all this money, clearly most of the money was spent by the cryptocurrency.
Well, I burst out laughing when
you liked it. Wow.
I mean, I burst out laughing, so it was successful.
All right, well, did you download Headspace and start using it?
No.
It was semi-successful then.
Right.
Well,
Did you download any of the crypto apps and start using them during the game?
No.
So Jen, you were excited by the healthcare ads in the Super Bowl, but since I, occasionally turn into the news programs in the morning and the evening, I was excited to see healthcare ads that weren't for people who were dying of dread diseases. So
ask your doctor about the drug I'm on, et cetera. Yeah.
The younger demographic, for the Super Bowl, they're trying to, have mental health or other kinds of things. When I see the other ads, everybody seems to be dying of something. Well, except for the drug that they're going to take.
Right. No, living a wonderful life. Yeah. Well, I mean, the one that I found the most laughable, not laugh with, laugh at, was the one for Meta. OMG, that was like a visit into like a Chuck E. Cheese.
That's right.
From 1988
with no legs.
No legs, and but with no legs, exactly. And I mean, I question the whole Chuck E. Cheese thing because I want to know who thought it was a good idea to have a dancing, singing rat in a food establishment. Don't know, but not a fan of either one, Facebook or Chuck E. Cheese. But that whole ad was just like straight out of some boy brain from the late 80s, which it certainly describes Zuckerberg as far as I'm concerned.
Yeah, it's pretty interesting. We're about to debate well talk. There was a long thread from Cory Doctorow or somebody about Facebook, and Facebook, stock plunged 25% because clearly what he essentially said was, if you go back to the 90s, right, to the bulletin, the BBS and the bulletin boards and the online chat, eventually that stuff became unusable because of spam and crazy people and communities. Ian, you and I have studied this forever, and with Bob Johansson at the Institute was one of the first guys to look at this way back when. But there's only online communities in general are very fragile things. You can blow them up, very quickly, as we know. And what it essentially was saying is that Facebook has held it together for a long time, but the fact that crazies now have just overwhelmed it is essentially going to kill it, and anybody sensible is going to leave, and the only people left will be crazy. The problem for that is, as we know from our friends over at the Light Collective and elsewhere, Casey, is that there's a lot of very valuable stuff that went onto Facebook because people thought it was going to be an okay, stable platform, and now decided that they can't do it for either for privacy reasons or for crazy reasons or whatever.
Oh, I mean, hell, for a number of years, from the the mid-aughts into the teens, I taught a social media, a corporate social media course through various places, and Facebook was a big part of that. And now I would tell people to run for the hills and don't. And I'm disappointed that it became globally. And I'm disappointed not in Facebook, but I'm disappointed in the fact that these people are now kind of being hung out to dry. Is that a lot of folks use both Facebook and still use Instagram, a Meta product, for what their website is. And that to me that's a betrayal, because not only Facebook people trust less than they trust Instagram, and I do think that a lot of people don't quite grok that Instagram and Facebook are the same company. It's not somebody else.
Right.
And, that's disappointing to me. But I still, full disclosure, will visit Instagram. I don't post there, but I look at things on there because there are some businesses that I would, restaurants in particular, that I would like to go to or whatever, and they're there. But,
it's
I'm so curious.
Oh, sorry, go on, Joe.
Oh, I'm so curious where all of the small health communities on Facebook are going to go. Because a lot of people
that's
are
an
moving
ongoing
away.
problem.
Yeah, a lot of people are moving away from that. But a good friend of mine just last year had her hip replaced, and a Facebook community was her best source of information and comfort. And I mean, I think she got more out of that than most of the conversations with her doctors. And so I'm just curious, where's that going to go?
If it's an evidence-based and scientifically sound and well-moderated community, it has huge value. And there's a lot of those on Facebook. But the thing that Facebook is doing to the people in those groups is what's unconscionable. Because the folks running those communities are doing everything possible, all the best things. But what's happening in the background is that Facebook is mining lots of coin, sort of without their knowledge or benefit. I mean, if Facebook would cut back, cut off some of the, whatever their stock is worth now, I don't know, it's less, but it still ain't nothing. Because what was it, 90 million? There was some $90 million fine they got for something recently. I've lost track, but that's still couch change for them. And this is my whole thing about, Web 2.0 or Web 2 or whatever anybody wants to call it, the rise of the platforms. And now we're pivoting into something else that people are calling Web 3. Yeah, well, okay, color me amazed. But, the issue is that what the promise of Web 3 is supposed to be is decentralization, more user control, perhaps ways that people can make money out of doing things online, which was kind of Web 2's. But the problem is, how do you centralize? I don't trust any cryptocurrency to the point where I'd start taking payments that way, because how do you turn it into actual cash? No one has really convinced me that works yet. Yeah. So I'm not downloading any crypto apps or doing anything with that, or saying, yeah, sure, PayPal, I'd like to put some of what people pay me in whatever, with they use your thing or Stripe or whatever into crypto. Sure, no, not interested. I want American dollars or euros, please. Thank you.
I will have to replay the bit from Silicon Valley where Guilfoyle says, it goes on about fiat currency. But going back to the Facebook one, some people may not know this. It's worth restating. It's been a while since I think you and I were involved in this a bit, Casey. But Andrea Downing, who's at the Light Collective, looked into this in depth around the time of the Cambridge Analytica thing, and found that with third-party software, any member of any private group could download.
No, anyone on Facebook, anyone on the internet. You didn't even have to have a Facebook profile. You could download not only what was in the group, but who was in it, and all of their networks. Yeah, everything about their profiles.
And it took Facebook a long time to respond to that, clean it up. But the only time I saw it being used publicly was something that kind of I approve of, right? Which was that somebody infiltrated got a private group that was, a white supremacist group, and found all these people who were law enforcement officers in it. So that was actually, and that was exactly the technique.
Well, but then there were all the cases. There was that huge rape survivor group that was invaded with kiddie porn and
but I'm not sure that group got its members down. Were downloaded or whatever, but certainly it meant the technology was out there for many years where you could download and find all these people.
From about 2015 was when the browser
about 2018
Grouply.io was available. It's no longer there.
All right, sorry, Michael.
Oh, by the way, Cambridge Analytica, I was writing this in 2018, before they went kaput with those findings, they were getting into social determinants of health and selling this stuff from other places to the
it's still going on. It's just Cambridge Analytica is gone.
Right, the secret analytics and all that is still being sold, but it's coming from, scraping the web and all the rest of this, and people don't know it. I mean,
and all of the deals with Google and Ascension and, basically, if you have one of these, whoever your provider is, whether it's Verizon or T-Mobile or, whomever it is selling you on the daily, all day, every day. Even if you turn your location stuff off, they're still selling you and your human activity and they're still charging you a bucket for the service. Yeah. So there you go.
Right.
Yeah, but I mean, so back to Jen's key point at the beginning, the sad part of this is because their egregious business practices have contaminated the platform, you put at risk some legitimate uses and positive uses that exist.
Oh, yeah, absolutely.
That's the sad part of it all.
Yeah, I mean, that's one of the reasons that I've been on this FU pay me for my data thing for years. I mean, this predates Cambridge Analytica.
The theory is, right, so, you have to take this with a massive grain of salt and, not be Larry David or Casey in terms of saying that the crypto stuff is all, and there's a difference between gambling on crypto. And, it is quite interesting that, me and Ian come from a background where gambling on sports was a part of British culture and particularly Australian culture.
Every
go down to Tattersall's and put in your bet.
I mean, every corner in Glasgow had 3 pubs and a bookies.
Absolutely,
that was
but it was usually Tattersall's.
And now that's now it's semi-legalized in many states, not in California. But that's the first time I've seen sort of national. When I look at national cable TV that's national rather than local TV, it's a lot of commercials for that stuff that's not just for Indian casinos, but actually come to whatever and bet on football this way or bet on that way. But the combination of sort of stock trading, Robin Hood type, which is most stock trading, right? The meme stuff, the gambling on sports and the gambling on crypto is getting, if you took that lot out of the Super Bowl ads, there's probably NBC wasn't making much money, right?
Yeah,
but
and I mean, with the sports book ads, I always want to, I look at it, I see it go by and say, and your first hit of heroin is free.
Of course.
Because it's always like, we'll give you $500. Oh yeah, and you're going to lose that in like 9 seconds flat, maybe 4.
But the idea of the Web3, DAO stuff or whatever, and is that you could create something like a patient community where you could control your data, you could do all this stuff, you could sell it. And I've seen examples of this type of stuff roll out of Health 2.0. I'm semi-associated with a current thing which is trying to do a sort of what's called a quantum privacy network around this stuff. We're groping in the dark towards where this stuff might end up, and you can already see the scammers and the profiteers taking it over even before the other stuff is kind of grown, but it may be our best bet, because we've had this conversation before, Casey, on your podcast, which is I like the idea of people getting paid for their data, and clearly there is a value to particularly recruiting rare patients with rare disease for clinical trials, which costs a lot for each pharma company, and you can imagine some of that payment heading towards the patient.
Absolutely.
But in general,
I see the opportunity for communities. I've been on this thing. If you pay me for my data, like as an individual thing, recognizing that that's hugely problematic and it's never going to happen, but at least it starts a conversation. And the promise of DAOs, which is huge, the promise of DAOs only has to get past the current problem that is everything that starts decentralizing has to find a way back to re-centralizing, at least in a monetary way, because otherwise, how do people really get paid then?
Yeah.
If, whether it's a group or a group of groups or a group of individuals, whatever, but bringing it from crypto something, oh, that's cool. Is it Ethereum? Is it Bitcoin? Is it Dogecoin? What is it? And what's that anyway? And then, but how do we turn this into something I can use in the grocery store? Because or use to keep the servers running for the community that I'm running, et cetera, and not burn down the planet with, crypto mining. We haven't solved that one yet. So stay tuned.
We're still on. Michael.
I want to sort of draw a circle back to some things that we were talking about with healthcare. What you have is slogans about decentralization and democratization that end up taking us to semi-Lord of the Flies or capitalistic, whatever, right? So there was an article in the Narrative Matters of the Health Affairs blog this week about a woman who was a health policy person, expert in Medicare and all the rest, then had to take care of her father at home, right? And had to try to coordinate all the people. So care at home sounds great, except the reason you had people at a central place was they can get all the services in one place and people come in and, it's all coordinated as opposed to, I've got to coordinate it and take different phone calls and all the rest of that, right? But the decentralization, like doing your own airline ticket, who does it work for? Or, and then you end up with the for-profit hospice, the decentralized communities, right? There's no gatekeeper, it's democracy. And then look what happens. So you end up with decentralization and democratization essentially running amok and without any gatekeepers. And it's like, how much poison does it take to poison a large amount of liquid, even if most of the liquid is fine? Right. And that's the problem. How much poison does it take?
No, but that's true. And you've just described the problems with both Web 2.0 and what happened with the age of the platforms and what's emerging now with this DAO Web 3 thing.
But it's also, as we say, if you ask, why do we need crypto, right? Forget you saying that you can trust it. What is the purpose of crypto serving that US dollars or euro doesn't? And where does that take you, right? And what is the purpose of some of the other things? And so, as much as all of us are kind of, power to the people, the problem is that power to the people often ends up really giving power to certain people, not to all of us the way it was supposed to. Sort of Arab Spring in healthcare and elsewhere ends up empowering some of the autocrats, and I think that's disappointing. I think to a lot of us, but perhaps something we need to again think about behind some of the slogans that we're all was it Data Liberación and all the rest of those wonderful slogans. Perhaps we need to think about that.
Yeah. I just wanted to weigh in. I think crypto is a very powerful way to money launder, but that's its only real.
Absolutely.
But
and fine art.
I was having flashbacks because my doctoral dissertation was actually about whether technology creates decentralization or centralization. And we're talking about geographically.
Right?
Study. Well, no, my conclusion is that technology doesn't have a conscience or a direction. It's an amplifier. It's a tool. Right. And so it can be used to do the Arab Spring, and it also can be used to, elect Donald Trump and spread disinformation. It depends how you use it. And I think you nailed it, Michael. I wasted 450 pages rambling on. You just said it in about a minute and a half. It depends what people do with it and who has the power. And that's really what it's about. It's about the power relationship in the final analysis. But we're getting very Marxist here, Matt. I
was going to wonder if the centralized power structure of the university would have given you a PhD for a sentence and a half.
Yeah.
They probably, somewhere they said they want that 450 pages.
Especially not an interdisciplinary PhD, because everybody thinks you're trying to get away with a fast one.
Can we go back to something Jen raised, right? Which is and I'd love to hear more from you, Jen, about this and kind of like how this is going to distribute and think about the employer thing that we raised earlier. Maybe Ian and Jen can talk about the PBGH thing, which is now no longer the Pacific Business Group, it's the purchasers.
It's the purchaser business group on it.
Because as opposed to the non-purchasing.
They didn't have to buy new monogram shirts. It was very important.
Yeah, it's a cost saving.
And I immediately went to Pittsburgh.
No, I know. Well,
I think they've gone to Pittsburgh. They've gone to Benderville.
Yeah, you're only as good as your vendor wear. So why change the logo?
However, Jen, you'd raise this issue, right, of particularly the Q, right, which is the home testing thing, and we're in a world where we're never going to get everyone. We're never going to get everyone vaccinated. We're not going to get. We as we said right at the start. I forget who said it. Was it Ian or Michael said that the pandemic is over, even though no one's told the virus that.
It's like you have a stop loss in your policy. After 1 million people dead, it's stop loss. That's it. We don't care about it anymore.
We don't care anymore, right? Great. But Jen, say a bit more about what you thought Q was doing, and sort of give me a sense of where you think the landscape is for devices and testing in the home, as part of the sort of the landscape the employers are talking about.
I think it's interesting. One quick side note before that. on the Pittsburgh Business Group on Health, there is also a Pittsburgh Business Group on Health, and it's run by a woman named Jessica Brooks, who's doing some of the best stuff right now in regards to health equity and addressing racial disparities. So if you're not following her on LinkedIn, go find Jessica Brooks from Pittsburgh Business Group on Health and sign up for some of the things she's doing.
They should merge with the new purchase of Business Group on Health, because they won't have to change their logos either.
Yeah, exactly. All of the above. All of the above. So what I thought about the Q device is that it actually is cute, and it looks like something you would actually want to use, unlike all of the COVID tests that I have bought from Walgreens and CVS, and when there have been very few of them on the shelves that are this kind of funky user experience, and you open them up and the instructions are just like a little bit different for each one, and so forth. So I think that idea of having a home device that's appealing is very interesting. Whether it has more use beyond COVID, I don't know. They said that they want it to be able to do things like STDs and pregnancy, but you don't really test for that stuff that often in most cases. So I don't know exactly what direction that's going. But there are a lot of professions where people need to test. Assuming that COVID is going to be with us for a long time, then we have a lot of professions that need to be testing people regularly with good quality tests, and having something like that doesn't feel like a drag every time you have to do it could be really, really appealing to consumers and employers.
More about that? When you say a profession needs to test, I mean, what kind of employers are you talking about? Well,
healthcare, of course. A lot of districts are testing their teachers regularly. A lot of the Bay Area tech and New York financial services companies are testing people every day if they're going into the offices. So I think there's a lot of appeal potentially for something that has scale like that. And we don't know how long that's going to last, or is there going to be something else that comes up in the future where we want people to be doing testing on the regular?
Ian.
Yeah, well, just going to build on Jen's comment. I mean, at the meeting last week, one of our keynotes was Geeta Nayar, who's the chief medical officer at Salesforce. And she had just come from, the Dreamforce meeting in New York with 5,000 people. But I mean, her basic message is a lot of corporations, not healthcare, are putting in a chief medical officer for the very reason Jen's talking about, because they're countenancing a world where they're going to have in person again, but with virus still circulating. I mean, they're not buying the Fox News line that it no longer exists, right? So, and legitimate things happen. I'll give you a personal example. My 10-month-old grandson get into UCSF, not the medical school, the daycare.
He must be very smart. He's getting it.
No, but he lives right next. He was born at UCSF, and he lives right there. And he his first week in daycare. Most of the other families there are work for UCSF, but the first week in daycare, somebody in the staff tested positive, so they had to shut it down. And then he had to be tested to get back in again. So it's to Jen's point, this thing that creates ripples of disruption beyond healthcare and that infrastructure. So I'm a huge fan of home health testing, provided you can, it's the old classic sensitivity specificity stuff, and in the hands of untrained users, do not underestimate how they could screw it up.
Exactly. And I mean, I'm a pretty advanced user. And I myself, because of course I did, at the very beginning of January, got a breakthrough. Despite being vaccinated and boosted, I got a breakthrough case of Omicron, which was not a big deal. It felt more like a cold. And then hilarity around clinical trials, which I got in one. Anyway. But to realize that even with my experience, because I had used these tests before, with the tests that I had at home, because I'm, a hoarder, I bought a bunch of tests. And I tested myself twice, once at day 7 and once at day 10 after my infection, and was still testing positive at day 10. So that would have told me that I couldn't go swim anymore until I did. But you can test positive after an infection for months with the current specificity, et cetera, of the at-home tests available. So I wonder, given Q's price point, how much more specific they are than a Binax now, or, you know, whatever would be. And then the whole thing about everybody gets 2 tests sent to them from the US government. Well, that's hashtag fail, at least in this household, because I ordered them the day before the site actually went live, that they said it when, you know, I ordered them, got a confirmation, whatever. They've never showed up. And the USPS is like, I don't know.
Really?
Mine got here. So, but there's something bigger behind this, right? And I think Q and what generates is interesting. So yeah, does Omicron 2, the variants, whatever, does that keep going forever? Do we never get rid of this and have to continually be testing? Because we're dealing with don't forget, the reason with this is we're dealing with a disease which is most transmissible before the symptoms occur. So, you know, you've got that massive problem, number one. And as Ian mentioned, it's got all these ripple effects on daycare and employment and God knows what else. But there's 2 other things going on, right? One is there's a bunch of stuff coming down the pike. It's not Theranos, but it's sort of, you know, in that zone where little bits of blood and little bits of spit and breath and other stuff going into devices, you know, are starting to be tested at home. You may or may not have missed that Roe, which, you know, sells boner pills on the internet, got another $150 million yesterday. And one of the things they talked about was like doing home testing for sperm and, you know, for fertility and whatever. And we had a company at Health 2.0, like 4 or 5 years ago, which was doing literally that, you know, fertility testing for men at home. So that kind of stuff, you know, and then, okay, Theranos is Theranos, but there are people figuring out how to do stuff with small amounts of blood. And there's companies I know who you can breathe into a device and it starts telling you what's going on in your breath and stuff. You know, that stuff is coming, right? And whether it's 2 years, 5 years, 10 years, what happens in now a centralized lab environment is definitely going to be decentralized into the home for a lot of people who have chronic conditions, just the way that blood glucose meters are now, where 50 years ago or 30 years ago they didn't exist. The other thing that's happening, that's had a ton of venture money going into it, is putting that infrastructure in for decentralized clinical trials. Going back to the issue of who's very expensive to recruit and find is, you know, if you can get somebody who's not very close to a trial center, can you get them stuff to them at home? There's a company called Medable, which has raised $600 million or something ridiculous amount. I have my own sad story about them when they were at Health 2.0 and didn't have any money to pay for their invoice. That's a separate issue.
Send them a bill.
I should send them a bill saying you owe me 4% of the company. But I did actually, and the CEO didn't reply and went on. Anyway, but I'm being unfair. She was very nice to me. However, but that area, right, we talk about decentralized remote clinical trials, and can you spread that? You're talking about overlaying this stuff onto infrastructure. And yeah, Q is the first time probably you've seen that kind of medical device in the house, but there's going to be a ton more coming for both the sort of chronic care management part and for the testing part and for the decentralized clinical trials, which are all connected in there. Anyway, Michael.
So take that over. First of all, I agree very much with Jen on Q. I saw a presentation by their folks a few months ago, you know, one of the maybe Med-City Invest, one of those, and it was impressive. They thought through making it simple. They thought through making it attractive. They thought through a lot of the different issues, much more than some others have. And you know, we have a lot of other things coming down the pike. But to go to that point, what Matthew was talking about, right, and decentralization. So you remember a few years ago, and now it's probably getting here, they were talking about the smart car, right, where they could tell whether you were drunk, and you know, and the steering wheels test your blood pressure. You know, Ford fooled around with this for a while, and the others. So now all of a sudden, you know, the computer in your car will be able to talk directly to your primary care physician and Facebook at the same time.
Casey is not driving anymore, I can tell that.
But really, what you're having, right? You remember what was it? The group that monitored everything about having a like
quantified self. You're talking about?
That's right, the quantified self. Well, all of us are starting to get into quantified self, and that has all sorts of ramifications. And now, besides the instantaneous stuff, go to what the government calls Z codes, which not a lot of people have heard about. Well, Z codes are for social determinants of health, I mean, who could be against social determinants of health, right? Stuff that you can't code. But any member of the healthcare team, meaning the harassed front office receptionist, can enter a Z code, which has to do with things like, how's your home life? Are you disconnected from this? All sorts of stuff that has to do with who you are, that now goes into your permanent record, as it were, in the medical record, put in by God knows whom to help whatever. And you're starting to see building up a real sort of data source where how good is the data? When does it get purged? What does it mean? All the rest of those kinds of things. And you have a fight with your spouse the day before you see the doctor, and all of a sudden, you're an abused person forever, or, you get into your car and you had one too many, and now that's in the, whatever, right? And it's all for good purposes, of course, but, right?
I can bring this back to sport. Let me go quick, and then I'll go to you, Jen, and then you, Casey. I can bring this back to sport very quickly. Number one, Winter Olympics in China. They basically have that social scoring already.
Very much.
And if you have a low score because you're semi-dissident, you may be shipped off to a concentration camp, but you might also just be banned from buying a train ticket or something like that. It's just like the Black Mirror episode. And then back to Q. It's good on healthcare, right? Because so Q raised $100 million a while ago. You know what else they did? Late 2020, they got a nearly $500 million contract from DOD to do testing. I think they've got 30,000 or 50,000 of devices out there in the wild amongst it. So that money that went to Gail Gatto and whoever else was super led. It's just our recycled taxpayer money. It's the way it should be. What I don't know is how much they've had consistent testing from DOD, from the military, and whether there's like actual learnings from that, and how much it's spread, and whether it's just they kind of got lucky with a dodgy government contract. That'd be interesting to find out.
Yeah.
Anyway, sorry, Jen.
Well, that gets to, and what Michael was saying, this gets to one of the biggest barriers in all of healthcare, which is privacy and trust. And with the testing and who has access to it, and should I not actually tell my doctor about my mental state because I'm afraid that that's going to get in my permanent medical record? And what happens if 10, 15 years from now, I can't get healthcare because that's a pre-existing condition? And, there's all of this fear around that. And one of the things that I think is most fascinating on the employer space and the work that we do is whether someone trusts a program has so little to do with the program itself and so much to do with the culture at their employer. And if you work for a company that you believe they have your best interest in mind, you will say yes to a lot of very invasive things. But if you believe that your company doesn't have your best interest in mind, you're going to shy away from things that are just super basic. And it's really interesting that element of trust and how privacy layers in all of this conversation.
Yeah, I will observe that the other risk there is when your employer is in charge of all of those parts of your life, involving health, is that what if your company is bought by someone else with a completely different culture?
Yeah,
I went through that long before. I was already using mobile phones and internet technology, but we didn't call it that then. It was 1985. And, but I worked for a company that was owned by RCA, which for its flaws, because it had certainly had them, was a much better place to work than GE, which is what bought us. Because RCA started NBC back in the teens of the 20th century, and it sort of invented radio, and then kind of became the first broadcasting network in the United States, and a really interesting history. But when they sold us out to GE for a mess of pottage for us and big golden parachutes for the C-suite at RCA, there was a cold wind that blew through that hallway, and it was ugly. And I kept saying, this is not going to be fun. And it wasn't. So, there we are. And that's the risk that we have accepted as a culture in the United States, that the people that we want to have be in charge of healthcare in this country should be employers. Well, that leaves a whole lot of people off the bus, because what if you're self-employed? And even then, with, say, the ACA plans on the exchanges, depending what state you live in, and the fact that most of the supports for that have been defenestrated since 2010 when it was passed by, trying to, nibble and bite and snick and whatever, get away from having that mean anything at all meaningfully and be Affordable Care Act. Well, ha, ha, ha. The guys who don't believe that healthcare is a human right won that round and several after. And, so we're still here having to trust Big Daddy employer, and because the Republicans, I'll say it out loud, are feared of the nanny state, while at the same time looking to become the nanny state of all the nanny states, because, my state our governor, new governor, just signed there won't be any goddamn masks in schools anymore, Bill, not just during his 4 years, but ever. There will be no masks allowed in schools ever in this state of Virginia anymore. It's like, okay, we're really ready for that next pandemic, aren't we now? Yay.
Like the folks in Georgia who are there were 17 state senators tried to start banning mandatory vaccines, not of COVID, but of like measles and Tdap and rubella for kids in school.
Thank you, Andrew Wakefield.
Well, as I said, there's the Andrew Wakefield successors are still hanging out on the Joe Rogan show. I've got a great piece coming out next week in THCB that someone just wrote to me about that, which is fascinating world. All right, sorry, I was going to go to.
I look
Michael.
forward to that. Please make sure you hit me with it. Don't there's so much. It's like I binge read. People binge watch. I binge read. But if you don't tell me it's there, I'll forget.
You are. I will attack you on all kinds of social media, Casey.
Please do.
Sorry, Michael. I think you're next.
Yeah, I mean, I agree. It's sort of a shame having been an HR consultant. I mean, the best companies do a great job for their employees, and the employees have no idea. I mean, was it the catalyst for reform for payment reform had a
catalyst for payment reform,
right? And the very non-HR looking guy from AT&T was talking about what they were doing, and the best, most, as it were, God help us, paternalistic companies do a terrific job that you cannot do as an individual. And one of the things, but they're kind of the exception of certain large companies. And one of the places that has not had democratization, because people don't even know it's possible, is trying to get quality information on providers. If you are a large company, you can get data on hospitals, data on doctors. You can do direct contact, and you can make sure that people get good care and not profit maximizing care, and not this is the way I was always done it care. You can do that as an individual. You cannot get that information, and instead we get this nonsense about price shopping, like that tells you anything, right? And look at the Yelp reviews, which are based on service, right? And that's one of the problems, is that the people with the clout can do it if they want, and the other people don't even know they can't get the information. And one of the disappointments to me is, again, where since the liberals are obsessed about universal coverage, and high prices just mean they're evil capitalists, and the conservatives are obsessed with the marketplace is going to work, both of them go nuts about prices, as if the internet hasn't shown us that you can put the prices down and then charge extra for resort fees or extra anesthesia, or do you want a single bed in the hallway or a single bed in a room, right? And they go crazy about pricing without anybody coming together and saying, excuse us, can we get some real measures of, patient reported outcomes? Do people get better after we give them the hip? Or, gee, what's your infection rate? And I know that my brother some years ago had to have a heart procedure. He was trying to do shopping, and I went and I looked at it was in New York, and New York State has, well, a few people don't realize it, on heart procedures, actual data on individual surgeons, which is not very common. He couldn't find it because it's very hard to find. I knew it was there. I found it. It was 3 years old, because that way, if you look bad, you can tell the patient, well, I've improved. If you look good, you go, of course I'm good. And I went and I said, you know what? The best data around is from the cardiothoracic surgeons. It's clinical data. It's submitted by them. It's current. So I went to a cardiologist I knew at the hospital that my brother was considering, and I said, can you give me that data on your surgeons? And he said, we're not allowed to see it. Now, the exception is because after all, this is America. The exception is if you want to voluntarily release your own data, that's okay. The group approves that. But nobody else, including the cardiologist at the hospital where you work, can see that information. And, meanwhile, we're going around with thinking that we're democratizing medicine because you can find out what to do on Facebook after you get your hip. That's great. Wouldn't it be good to find out, beforehand, which hip replacement device works best and which doctor?
Which surgeon has the lowest complication rate and the highest,
Casey, all you have to do is ask him.
You can ask Ernest Emery Conlon.
Well, no,
go to his grave; it'll be there.
Most replacement, you can go to Surgeon Scorecard on ProPublica, and if they report their data to send, there are ways that people, but it takes work.
So, before we leave, I did want to get to the point that Ian raised right at the start, which is what about PPG? We keep on getting close to BGBH and what they're up to, and his experience yesterday with all or this week, last week with all tell us what's up there.
Well, Elizabeth Mitchell and I've got this whole piece that's going to come out, and it's much of what Jan and Michael and Casey have said. The sort of 5 points are they're starting to set standards and buying to those standards. So really asking for a much broader set of metrics, not just price. They're resisting provider and payer consolidation. I mean, they were instrumental behind the Sutter lawsuit, and they're likely to use that same template in broader places. They're going to be doing disciplined purchasing of digital disruptors. I think it's relevant to your Health 2.0 site. They are curating and evaluating because there's just too many point solutions with outsized claims, and there needs to be referees and all of that. But most importantly, I think, are the last two, which is holding intermediaries to account. They're doing this health value index where they basically are getting the data from employers, as Michael said, and evaluating the intermediaries. And it's got the biggest health plans on tilt because these guys, Jen can speak to this better than I can because these are your customers. They are not happy campers with their health plans. I mean, they are a necessary evil, and they are going to start to hold them to account. And the thing that Elizabeth keeps pointing to is because of the Consolidated Appropriations Act of 2021, which 99.99% of Americans have never heard of, including me. But what it does do is it makes self-insured employers fiduciaries, right, for their employee health benefits, which is analogous to, if you have a wealth advisor who's or investment advisor who's a fiduciary, they can't just pimp your stuff. They are financially required to do the right thing, and that's huge. That to me is a pivot point.
That is.
And then the final thing, targeted public policy initiatives. So anyway, so I'd love to hear Jen.
Can I go to Jen, then Casey, then Michael? But everyone wants to jump in here. So.
Yeah, it's all super ambitious, necessary stuff because the healthcare system on its own is not going to improve outcomes or get people to quality providers. And I've said here many times, I think one of the most important things that employer-sponsored benefits need to do is focus on that quality component, get people to quality providers who have verified outcomes, where you're not going to be readmitted to the hospital after surgery. You're not going to have to go back and have things done, and also you're not going to actually have that high cost surgery unless it's actually what you need to do. And so a lot of the concierge programs that wrap around benefits, part of their huge value is preventing people from having horrible, costly, painful back surgery when they don't have to, and things along those lines. So I think it's all good stuff, but change is slow, and it's a huge employer market to move, which makes it really tough.
Jen, how many employers that you're talking to know about what Ian just found out about? And I knew there's some fiduciary stuff because Dave Chase has been talking about it forever in his Rosetta stuff for self-insured employers, but I didn't realize there was new legislation. Is that? I mean, people just how many years before that sort of gets? Is this like the doctor learning 17 years later they actually start doing the right thing, or is it becoming pretty aware? Are people becoming aware?
I I have faith that the consultants are doing their jobs and making sure that the employers know what's
Aren't you
going on
one of
with
them?
that.
But here's the metaphor, though. It was like when the government the FASB, Financial Accounting Standards Board, changed the ruling on retiree health benefits, that it became a liability in your balance sheet. That was it. That was the end of retiree health benefits in America as we know it. So these kind of arcane accounting and fiduciary changes can have ripple effects that are massive.
And Ian, and I had not heard about the fiduciary thing. I admit I'm that 99%. But what's fascinating is it's sort of full circle that COBRA, which gave us self-employed, which gave us self-insured health insurance in the first place, does not mention health insurance. The law was all about pensions. There's no mention of healthcare. That's to your point, but the unintended consequences. That started a whole industry and changed things forever. And now, in a sense, it's catching up with the fiduciary, which is really interesting. But you see, now that they're fiduciary, that means, Casey, you can trust your employer. So I think you no longer have to worry about it.
Well, no. I aged out. Well, I attituded out of employment.
That's what they attituding out.
And at the end of the 80s, and then I was a member of a union, so I was able to do that and continue to work under various union contracts because I belong to more than one union. And so continued to work for another number of years with affordable coverage through the union. But then when I went, anyway, long story, it'll all be in the book. But what I was planning on saying is that what Jen and Ian have been talking about benefits and self-employed insurers. And this is fresh on top of my mind because one of my next podcasts, it won't be the very next one, but the one after the next one, I talked to Neil Shaw earlier today.
He's a good guy.
Who is the chief medical dude at Maven Clinic. And I had, looked at that. I had not realized that they are now in 170 countries. And they also have 40% of the clinicians that work with them are clinicians of color. So there's that. And knowing Neil as well as I do, I know that the value and evidence-based medicine and let's not do something stupid is very much top of mind for him. It's not about selling the procedure. It's about making sure the patient gets what they need for their thing, whatever that is. And in the maternal health space, particularly in the US, because we still have, I think, one of the worst maternal mortality figures in the world.
Especially for Black women. It's Black,
especially women of color, especially. Yeah. And they've recently, Maven now is working with, I think it's Medicaid covered humans in, pregnant people in Arkansas. So that's huge because Arkansas is really bad. Oh boy, but not so bad now, maybe because Maven's there. But I mean, this is top of mind. And one of the reasons that they have been able to do some of the disruption that they've been doing, because they've been around for, I think, 8 years, but they've really accelerated in the last couple years. Can you say pandemic? Because a lot of what they do is using these
virtual
as
care,
opposed to having to go to a clinic. And it's, yes, I do, Michael. Anyway, there's a note in the chat. Do I know what the word Maven means? Well, yes, I'll let you tell the world because you're actually the nice Jewish boy. I'm just a shiksa who became an honorary Jew with 25 years in New York.
A Maven is a connoisseur, someone who really knows something.
Well, there you go. See, they really know their maternal health. They
do. Interesting. Full disclosure: I'm a teeny investor in Maven via some syndicate I'm in, which and it's about one of the very few apparently seems to be doing well. So I wish them all the best. Having said that, they're part of a much bigger thing, which is looking at specialty care or specialized population type care. Right, there are a whole bunch of people doing this. My former colleague at Health 2.0, Robin Burton, has Parsley Health, which is adjacent to it. There are a whole bunch of people doing this now for like migraines and GI distress and IBD.
But any employer that has a large female workforce, particularly women under 50, this is like a thing that you could add this to your benefit stack and be like way ahead of other people.
Yeah. But what you said about them working with the Medicaid population in Arkansas is really tremendous because one of the concerns, I think, with our healthcare system is that the employer-sponsored benefits creates this tremendous divide between the haves and the have-nots. Even within the spectrum of employment, employer-sponsored coverage, you have the leading edge, kind of the bleeding edge companies that spend all the money and have all the bells and whistles. And then you have the ones that are just meeting the requirements. But then when you look at, well, the whole world of who doesn't have employer-sponsored coverage, there's these huge gaps.
Yeah.
Yeah. Can I just say one thing? There's another company in the space called Equip, which is doing eating disorder treatment, and one of my favorite young CEOs, Christina Saffron, and they started with they've got 10 employers and a bunch of private people on board. They've just got their first Medicaid plan. I think a lot of this stuff, and there are companies like Boulder Health doing so a lot of people reaching out to Medicaid. I mean, the fact having said all that, the fact we have to have separate types of insurance based on your job, your age, or your economic status is a bummer. And it's not like everyone is completely fine and down and transparent about wanting this to go away, despite all the great stuff being done by PGBH and others. And I was reminded of this because on Health Policy Valentines on Twitter, which I must admit to taking part in, having made some very witty comments about APIs and endpoints, which I'm sure everyone was fascinated by, I found a tweet by an organization called the Alliance to Fight for Healthcare. And guess what kind of healthcare they're fighting for? They are fighting for the right to employer-based healthcare. And do you want to know who funds them by looking at their website? Or who's on their who their partnerships are, or who their who the people are? Well, you can look at their website and you won't find out because it's not on there.
Oh, well. Okay.
So we're not all quite in the world of transparency.
We're not
right?
so transparent.
Not as transparent as we might be. All right, we are close to getting towards the end here, so I'm gonna. We've covered a lot of ground today. It's been great fun. So I think it's time for us to go around, and we have about a minute each to talk about anything to conclude with this and what we think is coming up that's going to be interesting. So let me start with you, Michael.
Well, I think as we come to some sort of big ending, as it were, on COVID, will we come to a big ending, or will the new variants come and spoil the happy ending that so many people think we're doing? And I think it's going to be important, and it will be interesting to see whether or not the congressional attention to tech companies and all the things that they're doing that people know about out in the non-healthcare world, eventually what they're doing in the healthcare world comes to the attention of Congress, and we start looking at that. Right now, the healthcare world is off sort of the spotlight, as it were, because that's not what people see. But it will be interesting, and I think that those two parallel tracks I talked about at the beginning, the public health side and sort of the private entrepreneurial side, apart from Q, which was a great thing to talk about, will cross at some point.
Fantastic, Casey.
Well, I'm going to continue to watch this, Web3 discussion that keeps fulminating everywhere. But what I'm waiting for is to see what signal there is, if there is any, on the idea that this decentralized idea that keeps getting floated and keeps getting re-centralized by power structures, if this, resistance is human resistance to, we want a big daddy or not, so I'm going to be listening for a while. That's not going to reveal itself soon, but that's what I'm tuned to.
All right. Jen.
Well, we haven't talked about it a ton today, but there are all these places with the mask mandates ending, but the COVID rates are still really high. So what's going to go on with that? And are we ever going to go back to the offices? Kind of keeping an eye on that. Always top of mind. And we're right in the middle of all of the planning for the year with our clients and the different employers and benefit funds that we work with and so forth. So I think it's going to be fascinating to see where people decide to be really aggressive this year, where it maintains status quo, and kind of how that plays out.
I think we're not going to have the office. I remember rightly, Ian threw me out of mine in 1997 for being too messy. Ian.
Well, I'll be looking to see if we start World War III in the next week. I mean, that's basically one to avoid. But I'm singularly focused. We're taking the entire family, including the wee grandkids, to Isla in June. So I am obsessively concerned about exactly what Jen and Michael were talking about. I ain't over till it's over. And my one-liner is there's no end in endemic. So I'm not sure how this thing is going to play out, but I'm watching Denmark and the British BA2 variant taking over, and I'm just very concerned still. I'm glad it's over, but tell the virus, right?
Well, it'll find out. It'll be paying close attention once it's done with China, the Olympics, and everything else. All right, so that has been another spirited and fun THCB gang. We got through a lot there between decentralization, re-centralization, employers, and ending the virus and not ending the virus. A lot of fun. I had my guests were Ian Morrison, a health futurist all the way from Menlo Park, California. Michael Millenson from the frigid frozen tundra of Chicago, soon to be the spring. Casey Quinlan from Richmond, Virginia, and Jennifer Benz from the post-apocalyptic nightmare or fantastic place, depending on your opinion of what is San Francisco. That was your THCB gang for February the 17th, 2022. We may or may not be back next week. I am supposed to be up on spring break skiing with my kids, and I'll make a game day decision about whether we have it next week. But whether you're listening live or we're catching up on the podcast later, thanks for your attention. Thanks to my guests, and I hope you enjoyed this week's discussion.